Setting up your meeting for Facebook Live.
Oh, it says meeting is now streaming live on Facebook. On my end, it says that. I don't see it.
I think it's streaming now. Hello, everybody. Welcome to our first webinar for the Veg Spring e-market for the Toronto Vegetarian Association. I've got Dr. Anne Hussain with me here this evening, and she's going to be giving you a talk on period health on a plant-based diet, or plant-based period health. So we're really happy that we've got you guys joining us this evening. Even though we couldn't do this in person, it's great to be able to still have engagement with everybody and for you guys to be able to join us even virtually on a Friday evening and learn about great things. So thank you very much. If you're enjoying the Veg Spring e-market so far, we've got a link in our event post to donate to the TVA. It's veg.ca/donate. You can join to become a member at veg.ca/join. We're going to be hosting great content for the rest of the weekend. So we've got this talk tonight. We've had a lineup of vendors all day. It's been great. Same thing tomorrow with another live webinar at 2. That will be chocolate cake pops. And then Sunday we'll have 2 live webinars, one at noon and one at 2 on making great dessert sauces and running. So we hope you can join us for all of those and check out all of the vendors, like and share everything. We really appreciate it. So I'm going to turn this over to Dr. Anne, and she's going to take over the talk now. Thank you. Now I'm going to make you the host. All right. Bye, guys.
Thanks, Sarah.
You're welcome.
All right, so I'm just trying to make sure that I can see this live. So if anyone has any comments, so I can see them. Okay. Bear with me just for a second. Okay, there we go. Okay, hello everybody. I am here to talk about periods because I love talking about periods. So I want to start off by sharing a little bit of my story, and then we'll dive into all the good stuff about healthy periods on a plant-based diet, because that is how I fixed my period issues personally. So when I was 13 years old, I got my first period, and it was a complete shock to me. I went to the bathroom and I thought I was dying because bleeding from the inside equals dying. That's what we were taught. And then my mom told me about it. And then this was in Karachi, Pakistan. So we'd had no formal education around menstrual health. And so when I moved to Canada, I thought, okay, I'm going to learn about periods now. And lo and behold, I learned more about, calculating the hypotenuse of a triangle and calculating the effect of force of gravity on a basketball in the air, but I did not learn about my menstrual cycle as much as I wanted to. And if we think about it, we menstruate for 30 to 40 years of our lives, which accounts for amounts to over 300 times, depending on genetics, family history, personal medical history, pregnancies, surgeries, etc. So that's a heck of a lot of times to menstruate without really learning much about it. And as I grew older, my cycles became more and more irregular, and my family doctor didn't really have any insight apart from you're low in iron, you're low in B12, and you have a genetic form of anemia, so that's why your cycles are irregular. However, when I started at McMaster University, they became even more irregular, and I wanted a solution. So I went in, and she's like, well, you know what, I'm going to put you on birth control pill. And this was without a discussion around what my digestion was like. If she had asked, I would have told her I'm always constipated. This was without a discussion on what my mood was like. If she had asked, I would have told her I have really low mood. it was around without a discussion of, or a review of my family history, which does include cardiovascular disease. And we didn't even talk about the pros and cons of being on the pill. Most of us come from a paradigm where your doctor recommends something, you follow it. So I did. And that was a real turning point for me because my life changed on the oral contraceptive pill. My energy, which was already low, tanked even further. My mood, which was already low, tanked even further. My constipation got 10 times worse. I started getting acne for the first time. I started getting migraines for the first time. The one thing that came out of the oral contraceptive pill is that it worked really well as a contraceptive because I had no libido. So needless to say, after a few months, I had had enough. I went off it. I went back to my family doctor and asked, can we figure out why this is happening and what other options do I have? And she only had another birth control pill to offer me. And by this time I had done my research. I had learned that oral contraceptive pills do increase the risk of inflammation and migraines, cardiovascular disease, and clotting. So with my family history and my personal history of being on it, I did not want to do that. And I left really disheartened. And this is the story I hear a lot from my patients, not about the birth control pill and how everything panned out, but just that they're not feeling good. They know that there's something going on, but they don't get the appropriate care. And it's part of the healthcare system, right? Like we have a limited amount of time with our family doctors. And oftentimes we're also not taught how to track our symptoms as well as we should, because if we track our symptoms better, then we can relay that to our doctors better and they can help us better as well. So I'm going to share my screen and put up my PowerPoint. And then we're going to go through that. Okay, I'm going to keep it small. So today we're talking about healthy periods on a plant-based diet. So like I said, when patients sit in front of me, and I've seen hundreds upon hundreds of patients in the last 5 years of my naturopathic practice, and the common things that I hear are that no one ever told me this when I talk about periods, or no one ever told me to track my cycles. Or no one ever told me that my iron is low because my iron looks like it's in reference range. So these are the commonalities that I see in my patient population. And that's kind of where I want to start with today. I want to start with talking about why you should care about your menstrual cycle, because it's really important. Your cycle is telling you and what your symptoms throughout your cycle are telling you. And then we're going to get into the good stuff, which is plant-based strategies to optimize your hormones and your menstrual cycles. That's, like I said, that's how I shifted my health significantly using a plant-based diet. I went vegan around 14 years ago, and I have not looked back ever since. And I also help a lot of my patients incorporate more plant-based strategies, even if they're not plant-based. First, so in the next 20-ish minutes, 20, 30 minutes, that's what we're going to cover. And hopefully you're going to leave here with some solid information that you can start implementing. First, I want to talk about what happens in the menstrual cycle, because as I mentioned, my education in this was inadequate, and the women who I see also say the same thing. They're like, we didn't really learn about our menstrual cycle in school. So we're gonna go to school for a minute and just cover what happens during the cycle. So your menstrual cycle starts, so day one is day one of your full flow, not your spotting or anything like that. It's day one of your full flow. And then, it's day one of your full flow. And then from there, it goes on. So a typical cycle is from 24 to 32 days long. It can be on the 24 shorter side. It could be a little bit on the longer side, close to 32, but it should be regular for you. So if your cycle is typically 26 days, then your cycle should be every month, 26 days. So day one is full flow, and what happens after that is your FH, or follicle stimulating hormone, goes up. So during your period, your uterine lining shuts, and then your FSH starts going up. And what that starts doing, if you see in the top ovary part, is your follicle starts growing. So follicles are these sacs in your ovaries that have eggs in them. And then one of those eggs will be released at ovulation for possible conception. So during this first half of the cycle between your period and ovulation, which happens around mid-cycle, that's what's happening. Your follicles are growing, a bunch of follicles grow, but only one matures and ruptures. ovulation. And then in the middle, you have some estrogen and testosterone going up. So typically what I hear from most women is like after day 2 or day 3 of my cycle, I feel great. I feel most like myself. I feel like I have energy. I feel like I have motivation. And that's because your hormones have risen at that time. So you feel more motivated. You feel a little bit more energetic. You don't feel sluggish like you did in your premenstrual phase. And the estrogen also causes, if you look at the bottom, that red outline in the uterus, it causes your uterine lining to grow. And then your LH, if you see that orange line, your luteinizing hormone rises in the middle of your cycle right before ovulation. And that surge, which oftentimes you can test on a kit, on a pee stick, to see if you ovulated or not, that's what causes ovulation to happen. So that follicle ruptures open, releases an egg that now can be fertilized. And then that sac remnant starts making progesterone. So then you get a surge of progesterone and estrogen again in the second half of your cycle. And then your uterine lining is still now growing. So if you look at those last 2 uterine pictures, your lining is still growing. And then once your body realizes, oh, I did not conceive, your hormones drop. And that's when PMS typically hits. And then you get your period. Okay, so that's a basic overview of what happens in your cycle. So that takes approximately 24 to 32 days. The reason we care about your menstrual cycle is because, according to the American Medical Association, your menstrual cycle is your 5th vital sign. So the other 4 vital signs are your heart rate, your breathing rate, your blood pressure, and your temperature. So your menstrual cycle actually gives us a lot of information of what's happening in your body now. So like if you have severe PMS symptoms, it can tell us that you have, a hormonal issue. It can tell us you might have a digestive issue. It can tell us that your body needs some kind of support. If you feel super fatigued with your period, that could indicate an iron deficiency, for example. If you're having a lot of clots and a lot of pain, that could indicate endometriosis, for example, which is an immune dysfunction and inflammatory process. So we can get a lot of information about what's happening now, but your history of menstrual cycles also tells us a lot of information. So the age at which you start getting your period, which is called menarche, for example, if you started your period pretty late, like at 17 years old, that actually puts you at a higher risk for osteoporosis in the future, because at puberty, when we start our period, that's the time where we accumulate most of our bone density. And that in our menstrual cycles in general, with the estrogen, it impacts our bone density. So if you're someone who has irregular cycles, or you started late with your menstrual cycles, or they were there and then they stopped all of a sudden for some reason, that decline in estrogen impacts your bone density and puts you at risk for osteoporosis and osteopenia in the future. And then what's happening is can also predict other things in the future. So your risk for breast cancer, for example, endometrial cancer, ovarian cancer, and also cardiovascular disease, and also neurocognitive disease. So dementia and stuff like that. So that's why we really care about your menstrual cycle. We want you to produce hormones in a cyclical fashion because your physiology depends on it and your body depends on it. And the best way to start supporting your cycle is actually to be more aware of it. And we do a good job of, writing down the first day of our menstrual cycle, but then everything else goes by the wayside. And it's super interesting to me because women will come into my office and say, Dr. Ann, some weeks my sleep is great, but some weeks it's totally off and I don't know why. And oftentimes when we start tracking cycles, we know why. It's because of the hormonal changes that are happening. And that goes for digestion, that goes for skin, that goes for migraines and headaches. So many things we can relate back to the menstrual cycle if you better track of them. And now we have so many different apps, so you can use a ton of different apps to do it. So the first thing you want to start noticing is the length of your cycle. So like I said, 24 to 32-ish days, that's the length of a normal cycle. But for you, it should be pretty consistent. So if you're 26 days, then your cycle should be almost every 26 days. For me, it's 32 days. So my cycle comes every 32-ish days. It might be a day up or down. And then if you tend to skip a cycle, when does that happen? So for me, I tend to skip a cycle if I'm traveling, if I'm super stressed. because when I'm stressed, I will also not sleep well. I will also eat a little bit more poorly. I will not exercise. Everything goes by the wayside. So those, I know when I travel and when I am really stressed, my period will disappear or just be a little bit longer. My cycle will be a little bit longer. So you also want to take note of your patterns. The next thing you want to look at is flow quality and flow quantity. So if you're soaking through a pad or a supersized tampon every hour, that's not normal. That's too much. That's really heavy flow, especially if there's also a lot of clots. And if it also lasts long. So all of those things, and just, if there's also pain, that could indicate endometriosis. That could indicate something that's going on that we need to address. Normal flow typically looks like, you're changing a pad every, four-ish hours. It might be a little bit heavier on day 1 and 2, and then it tapers off. If you have clots, they're really small. Anything bigger than a quarter is too big. We want to take note of that, and we want to address that. Then we want to also take note of pain. So where are you getting pain? Are you getting abdominal pain? Are you getting back pain? Is it radiating down your legs? Are you getting numbness and tingling? And then how many painkillers are you using? Because the problem with a lot of the women I see is that they normalize everything because they've been getting all of these symptoms for so long. So even though those symptoms are not normal, they have normalized it for themselves because that's what they keep hearing, that periods are supposed to be super painful. Menstruating, like having a flow of 10 days is normal. It's not. Or taking 6 painkillers in a day for your pain, or missing a day of work because of pain and nausea, also not normal. So a lot of us normalize things that are not normal. And I'm just going to say, if you have any questions, you can throw them in the chat box. I'll see if I can look at, I don't know if I can look at them, but I will try. And if not, you can always, I'll give you my email at the end. You can always email me your questions. So pain and painkillers are really important to keep track of, because some women are like, yeah, my pain is okay, but turns out that they're taking 5 painkillers a day. And then we want to look at vaginal discharge and cervical mucus. So cervical mucus typically will look like, obviously, flow at the beginning, and then when the mucus starts, it's a few days after the flow ends, and then it will ramp up during that ovulatory phase, because we get a lot of compounds that are released, and also we want to thin things out for sperm getting into getting closer to the egg for conception. And then you might see a decrease after that. If you're getting like yellowish green discharge, foul smelling, if it's like white or anything like that, that could indicate an infection. I will say that a lot of women say that, okay, so my vaginal discharge has a smell. Having a scent or an odor is normal, because like it is discharge, so it will smell like something. If it smells bad, that's not normal, but having a distinct odor is probably a little bit normal. And then you also want to keep track of things like energy and motivation, digestion, your sleep, your mood, your allergies, because these will change over your cycle. If we look back to this chart, look at your hormones. Your hormones do this dance, right? They go up and then they go down, and estrogen goes up and then down and then up again. So you're not supposed to feel static throughout your cycle. We live in this man's world where we go by the male 24-hour clock. So men, they have cortisol and testosterone that goes up in the morning, and then it wanes throughout the day, and then the next day comes and the same thing happens over and over again. However, with women, yes, we have a cortisol going up in the morning that wakes you up, and then it wanes throughout the day, but we also have this overarching monthly cycle where our hormones are doing this dance, and we think that we should feel the same day in and day out, but our hormones are affecting our neurochemistry. They're changing our biochemistry. They're changing how we digest our food, how we metabolize our food, how we think and act, how we sleep. So it's kind of ridiculous to think that we've been trained in this way, or we grow up in this way thinking that we're supposed to feel like this all the time. It is not true. Okay, we don't want super erratic changes, don't get me wrong, but we definitely can feel a little bit up and down, and that's normal. So typically what that looks like is day 2 or 3 of your cycle. So after your period starts, most women will feel pretty good. Like, I have energy, I have motivation, I feel like myself. And then around ovulation, there might be a little bit of a dip, because ovulation takes a lot of energy, but then it's still good. And then after the hormones start coming down, that's when you might see a little bit of a lull. And typically when a lot of women will feel, a little bit of bloating, a little bit of emotional, being more emotional, slightly irritable, and during their PMS time or premenstrual time, and then the period will come, and then they'll feel a little bit better again. So knowing that that's how your body, or that's how your hormones are acting, actually helps you feel more compassionate to yourself, and also helps you feel like, okay, this is what's happening in this time. Let me plan my schedule a little bit accordingly. That being said, if you're getting like super erratic mood swings before your period, or getting like super bloated all the time, that's not normal. A little bit is okay, a lot is not okay. So this is the issues, like I said, we face as menstruating women, especially women in general, but menstruating women especially. Women are under-researched, underdiagnosed, undertreated, undersupported, and underaware. So a lot of, when we look at nutrition research or any research, actually mostly is done in men, because research is easier to do in men, and also, patriarchy. Um, but that aside, it's harder to do research in menstruating women because of these hormonal fluctuations. These hormonal fluctuations make it harder to have control in a randomized controlled trial, right? Because if hormones are doing this and your metabolism and your physiology is changing as a result, then you don't have that semblance of control that you need to do a robust clinical trial. This is why so much nutrition research has been done in men, and then we're extrapolating that information to women, which doesn't necessarily work. And I see it all the time in my practice. Women coming in on the keto diet, and then after 3 months, they're like, oh my gosh, my thyroid is off. Or I'm like now not losing weight and I'm just gaining weight. Or I feel really sluggish and crummy. It's because that keto trial was done in men, not in women. Same thing with intermittent fasting. We're taking intermittent fasting that is done in men and then extrapolating that to women. Women are not small men. Women are women. So we have to keep that in mind when we're analyzing research and taking everything with a grain of salt. And I think that's some of the issues with treatment plans for women in this day and age. There's a lot more research that's being done, and that's been done, and that is being done in the last, I would say, 5 years and currently. However, we still have a long way to go when it comes to understanding the intricacies, because there's so many intricacies when we look at the research and the hormonal interplay. So oftentimes women are then dismissed more easily, and they're also over medicated. So the two top medication classes that are used in women in Canada and between the ages of 18 and 45 are oral contraceptive pills and antidepressants. And both of those medications are often used for conditions that can easily or more easily be managed with lifestyle and dietary changes, but those dietary and lifestyle changes are often not addressed. My doctor didn't ask me about my constipation, because if she had, then she would know that there's extra circulating hormonal metabolites in my system. I'm not eliminating properly, and I'm also not absorbing things properly because digestion is completely off. So I'm not anti-medication. I love my doctor. I still see my doctor regularly, but we didn't get to the root of my issues. And for me, because I was in a biochemistry program, I then went to my textbooks and I went onto PubMed and did a lot of research. And it turned out I had polycystic ovarian syndrome, because by that point, my cycles I changed a lot in my diet. So I became plant-based, and that changed my skin. It changed to a good extent. It changed my digestion to a good extent, but my periods were still off because my hormones needed to be supported in a different way. So I was given the diagnosis of polycystic ovarian syndrome, which is characterized by higher testosterone and insulin levels, and sometimes you have cysts as well. So, so for me, becoming plant-based was a really great option, because then I was introducing more and more anti-inflammatory foods, more and more fiber into my diet. And then I combined that with naturopathic medicine, and I really supported my periods. They became regular. They're still regular to this day. And I continue to eat plant-based. So like I said, medication is not always the option. It shouldn't always be the first line option. And that's what was provided to me definitely there's a place for medication, especially if you're looking for contraception or contraceptives. That works beautifully, but oftentimes oral contraceptives are being prescribed for painful periods and for acne related to periods or mood changes related to periods. And there's a place for them, but oftentimes that diet and lifestyle piece is missed. And that's what we're going to talk about next, because that's why we're here. So I want to share with you first some of the common trends. Sorry, there's like hair in my mouth. I want to share with you some of the common trends that I see in my patients who have menstrual issues and also just general other concerns. But if we think about it, anything that will help your periods will also support your overall health, and anything that will support your overall health will also support your periods. So they're one and the same. Nothing in your body works in isolation. Everything is connected, and those are only some of the hormones. The hormones that I showed you before, they're only a few of the hormones that have a role in our bodies. There's so many other hormones that are important when we're considering period health. So the biggest one that I see in my plant-based patients is inadequate protein. I know, as someone who is plant-based, I hate the question, where do you get your protein? This isn't about that. I'm seeing that women are not aware of how much protein they're taking in, and usually it's not enough for what their body needs. That's what I mean by that. So you need protein. It doesn't mean that you need animal protein, you just need protein. You need protein for your hormones to be generated. You need protein for your neurotransmitters to be generated, for your skin to heal, for your hair to grow. One of the things that I notice, if I've had an off week where I didn't really pay attention to what I was eating and maybe I was eating too much junk, my hair will start falling. And oftentimes when a lot of my plant-based patients come in, they're like, oh, my hair has been falling. Is that because of my iron and B12? Look at their iron and B12. It might be low end, but then I'll go through their diet and I'm like, you don't have enough protein, because that's how this will grow. That's also how this will grow, nails. And that's also how your skin will heal. So we need enough protein. And if you're going to ask me how much protein is enough protein, my answer is I'm not sure. And the reason is that it depends on your body, and it depends on what you're doing in your day, and it depends on a lot of other factors. What else is in your diet? It depends on a lot of things. And like I said, a lot of that nutrition research has not been done in menstruating women. So we can't really accurately measure the need and just generalize that. Second thing I see is too many refined foods. So that could be refined flours and stuff like that. That could be refined sugar. Sugar is a big one that I see, and both of those cause a lot of blood sugar issues. So if we're using refined, like white flour products, for example, and a lot of like sugary stuff, then our insulin levels go up, and insulin drives a lot of inflammation, and it's pro-clotting, which means that it also clogs up our system. Yes, plant-based people also tend to eat a lot of fruits and vegetables, which counteracts that nicely. But I also see a lot of my plant-based patient with acne, and usually at the root of the acne is too many carbs and not enough, again, going back to that protein, not enough other stuff. So blood sugar issues, inflammation kind of go together, and a lot of inflammation also comes from the gut. So like I said, for myself, constipation was a big thing for me. And honestly, the constipation, I didn't even think it was a problem until I realized what the definition of constipation was. A lot of people think, again, we normalize all our symptoms. We think that going once in 3 days is normal because that's what our bodies have always done. But what you want your digestion to look like is having a bowel movement daily, and not like a really loose one and not really bitty one. You want to have a nice solid bowel movement that is easy to pass and that you feel like you've fully evacuated afterwards. Other digestive concerns that I see really often are gas and bloating. Sometimes heartburn, not so much, but gas and bloating. And that usually will lead to inflammation, because if your bacteria are fermenting foods and things aren't transiting well, then you're not going to absorb things and you're going to increase inflammation in your body. And inflammation is this general term, but it can look like a lot of things. It can look like pain. It can look like acne. It can look like brain fog. It can look like fatigue. It can look like loss of hair. It can look like rashes. It can look like a lot of things, or overt digestive issues. Then the other thing that I see often are nutrient deficiencies. So I mentioned before that I was always B12 and iron deficient, and I have in my lifetime taken like horse pills of iron and nasty tasting iron chewables and iron tablets, all sorts of things. And honestly, you know, when my iron shifted and my B12, they first became normal when I shifted to a plant-based diet. And I think that's a huge part because my digestion started working properly, which means that I could actually absorb things. So nutrient deficiencies that are common, and honestly, these ones are common in my omnivorous population also. It's not just pertaining to plant-based people. So it's iron, B12, vitamin D, omega-3s. So omega-3s are talked about quite often as what do we need them, do we not need them? So it really depends on who you are and what you're actually into your mouth and putting into your body. But you do need omega-3, so the EPA and the DHA, you need them for resolving inflammatory processes. So the last step of inflammation or resolving an inflammatory process, it utilizes EPA and DHA. So whether you're producing it on your own from plant-based sources or you're taking some in, we do need a little bit in there. Dehydration is another big one that causes a lot of issues, not just period issues, but I see it a lot in my women who experience a lot of menstrual pain. Because if you think about it, your muscles will stick like spaghetti to your fascia if you don't have enough water in your diet. And it's exacerbated if you're having high amounts of caffeine and if you're having high amounts of alcohol. Research has shown that alcohol and caffeine worsens PMS symptoms. Okay, so keep that in mind. And that's symptoms of anxiety, that's symptoms of bloating, and that's symptoms of headaches and pain as well. And then non-food related, lack of exercise and unmanaged stress are the other two that I see very often that impact menstrual health. So those are the things that we want to consider. And next, I want to show you the things that you should do. So if you want to grab a piece of paper and a pen, or you want to make notes elsewhere, please do. I'll give you some examples of all of these things. These are just general things. So we want to have lots of fruits and vegetables. That goes without saying. I call it a plant-based diet for that reason. Like I said, I'm vegan, but I call it plant-based because we want to move people towards eating more plants. So fruits and whole foods. So fruits and vegetables, whole grains, stuff like that. Fruits wise, I love things that are high in antioxidants, especially in the premenstrual phase. Things like berries. So wild blueberries are my favorite. They have more antioxidant potential than domesticated blueberries. Pomegranates, cherries, raspberries, blackberries are all great sources of antioxidants. And antioxidants decrease inflammation. That's why we want antioxidants. Plus, when you get whole sources of antioxidants, then they're also complex with other antioxidants. So it's not good enough to just take a supplement, in my opinion. I would much rather people take antioxidants in their food unless therapeutically they need it for a different purpose. Veggies, some of my favorite ones for menstrual health and hormonal health specifically are cruciferous vegetables. So your broccoli and your cauliflower and stuff like that, and your dark leafy greens. So rapini, chard, arugula, stuff like that, because that actually helps sequester extra hormone metabolites out of your system. It'll bind those extra hormonal metabolites and support your liver detoxification phases. Going back to the hydration that I just mentioned. So hydration is key. Hydration is key for so many things. You eliminate better if you're drinking enough water. And that could look like tea. I love herbal teas. And some of my favorite ones for healthy hormonal health look like licorice, especially in people who might have PCOS, if you have PCOS. For the menstrual phase, so when you're losing blood and you need some extra iron support, I really, really love nettle leaf tea. If you have some pain, then red raspberry leaf tea could be helpful. Like those kinds of herbal teas are great ways of getting water in without the caffeine, right? Because caffeine is dehydrating. And with the hydration, that's what I'll say as well. Decrease caffeine consumption. It doesn't mean that you have to eliminate caffeine or coffee. It just means decrease it. And same thing with alcohol. Like I mentioned before, alcohol and caffeine have been shown in clinical research to exacerbate PMS symptoms, and I see it in my practice all the time. It'll also exacerbate pain and sleep issues, especially in that premenstrual phase when a lot of women tend to have more pain and more sleep issues. Removing inflammatory foods. So this can look like a lot of things depending on who you are. So definitely removing or limiting the amounts of processed foods that you're having and refined sugars that you're having, because they are slightly more inflammatory, but also things that aggravate you. So common ones that I see in my practice are dairy. Eggs are a big one, especially with acne. So I became vegetarian before I became vegan, and my acne was not clearing up as well, but it did clear up once I eliminated the eggs. So this was long ago. So removing foods that are inflammatory to you, super helpful to your whole health. So yeah, I mentioned dairy, I mentioned eggs, corn is also a big one. And then the last one would be gluten, especially if you have some kind of autoimmune condition as well. So I have something called Hashimoto's thyroiditis, which is an autoimmune thyroid issue. So I try to avoid gluten as much as possible. Sometimes I eat it, but I feel pretty sluggish after eating gluten. Focusing on whole unprocessed foods is a big one. Limiting refined sugar, we talked about that already. And then having a better idea of your protein intake. So I find that a lot of my, like I said, vegan and vegetarian patients, they don't have an idea of how much protein they're actually taking in. And oftentimes when we look at the ratios of carbs to protein to fat, it looks something like 70% carbs and then 30% protein and fat. And oftentimes it's 20% fat and then 10% protein. So that's not an optimal profile, especially if you're finding that your periods are more symptomatic, or if they've maybe even disappeared. So you definitely want to make sure that you have enough calories in your diet, because low caloric intake also associated with disappearing and more symptomatic periods. And then you want to have a robust protein intake. Oftentimes I'll recommend, especially if we're starting off with a pretty low ratio of protein to other things, I'll add in a protein powder in a smoothie and fill that smoothie up with lots and lots of berries and greens and other nice things to boost that protein intake up. So to give you an idea of what enough protein might look like for someone like me, for example, I'm 5'1". I'm a pretty small person. That could look like a smoothie that has 25 grams of protein from protein powder and the various vegetables and fruits I'm putting in, and nuts and seeds, plus a cup of quinoa with a cup of edamame or a cup of chickpeas. So that would amount to approximately 50 grams of protein a day. And for my body, that actually works really well. So it could look something like that. And then any extra protein is extra protein. And you don't also have to get the same amount of protein every single day. Your body's resilient. So if you're getting a general amount of good protein in the span of a few days, that's enough. But I would really, unless you have a history of disordered eating, I would track your protein intake. If you do have a history of disordered eating, definitely talk to someone. I would say even if you don't have a history of disordered eating, talk to someone who knows what they're talking about to figure out what your body needs, because that's the most important thing. Getting blood work done. I'm all about the blood work. I love looking at blood work and optimizing it. Our reference ranges on Ontario, especially if you're in the area, are really wide. For example, if we look at ferritin, which is your stored iron, the reference range goes from 11 all the way to over 200. That's a huge range. And I get so many women in that low range that their ferritin is under 20, and their doctors have said, your ferritin is fine, we don't need to worry about it, and they're feeling tired. If you're feeling tired and your ferritin is low, below like 50, we need to bring that ferritin up. So blood work is really crucial to get an idea of what's happening metabolically in your body. It obviously doesn't give us all the answers, but that combined with what you're telling us, because you're the expert on your body and how it feels and how you feel, combined, there's so much information there that we can piece together to get you to optimal period health and optimal health in general. And then the other things that we already know: manage your stress, make sure you're moving, and then, like I said, tracking your symptoms and your cycles. I get so many women who, my sleep is on 2 weeks, my sleep is great 2 weeks. Let's write down when the good weeks are and when the bad weeks are. Or my digestion is up and down. Let's track to see what food you're eating on the day. It's feeling crummy. What food you're eating on the days that it feels good, and then where that lands in your cycle. Because most often the terrible symptoms are happening in the second half of the cycle, leading up to the period, because that's when things are a little bit inflamed anyway, depending on who you are. And then let's not follow male research models. Let's follow women-specific research so that we can optimize our health, because we do have these hormonal changes that happen. So instead of extrapolating from male research and then saying that, oh, this research shows that ketogenic diets are great or intermittent fasting of 16 to 8 is great, those are usually done in men, or they're done in postmenopausal women, so women who aren't cycling anymore. So that's the second group of, in women, like there's more research on that population, again, because they're not cycling anymore, so it's easier to have the control over the confounding variables in that population. So that's basically what I wanted to talk about in regards to things that come in the way of healthy menstrual cycles and things that you can do to support healthy menstrual cycles. And and I'm a big advocate of self-awareness. So like the three overarching tenets in my practice are self-awareness, self-compassion, and self-advocacy. So when you start being more aware of your body, you can actually advocate better for yourself and for your health. That's exactly what I did. I started tracking all my symptoms. I took them to my doctor and said, hey, can we test me for PCOS and Hashimoto's thyroiditis? And then we ran the testing, and lo and behold, I had PCOS and Hashimoto's thyroiditis. And then I could get the care that I needed and transform and take the steps to transform my health, which I did because my cycles are now regular and great, you know, apart from the odd time when I don't take good care of myself. And just one more note, right now we're doing this during COVID-19 physical distancing. Your PMS and your periods might be a little bit worse. This is what I'm hearing from a lot of people. A lot of my patients are saying this. A lot of my friends are saying this, that, oh my gosh, like I wanted to bite my husband's head off, or I just ate a whole bag of chips and then a whole bag of cookies because I had no self-control. And then my anxiety's been high and I haven't been sleeping. So if your PMS symptoms are a little bit worse right now, it's okay. It's a lot of it has to do with the stress and the lack of structure and the rug being pulled from underneath our feet at the moment. So take some time, drink your water, make sure there's some greens in your day, move a little bit, breathe deeply, and move on. Like it's not permanent. It will change. We don't know how long it will take, but it will change. And I don't want to leave you hanging. So if you want, you can go to my website and go to this link at the bottom, annhussain.com/PMS. And I have prepared for you a plant-based PMS manual with a lot of the things that we talked about today, but specifically what research has shown helps with healthy or premenstrual phases. So decreasing PMS symptoms in those 2 weeks. And a lot of it is what we talked about today, but you can get that. It's free. It costs you nothing. You just enter your email and I will send you a copy of it. So I'm going to keep that up for a second longer. I'm going to try to see if I can read comments. And my Instagram handle's on there too. I hang out a lot on Instagram, so you can always come hang out with me. And if you have any questions, you can also send me a personal email. I'm happy to connect with you. My email is Anne, ANNE, @annhussain.com. I'm going to stop sharing my screen for a second so I can look at other stuff. Okay. And then, okay, I think we're good. So like I said, that's it from me. There are more events happening this weekend, so please tune in. Sarah mentioned some of them at the beginning. And then, you know, the TVA is a nonprofit organization. So if you so are inclined to, veg.ca/donate is a great place for your donations. Again, I am Dr. Anne Hussain. If you want to connect with me, you can find me on Instagram, or you can connect with me send me an email. I love connecting with women. So that's it for tonight. I hope you guys have a great weekend and enjoy the events put on by the TVA. Bye.